Welcome to the Talking Turning 65 live stream, where you look forward to being 65, or you wish you were still 65 and want to make the right decisions for your retirement years. Grab a pencil and notepad and join us to find out ideas to build security in your healthcare, wealth care, and estate care. And now is a good time to tell a friend we are live. And now, here is your host, Mark Rogers.
Hello, everybody. Good morning, good morning, good morning. Monday morning with Mark and Leith coming up here on the Medicare stuff. And it is the live stream we turned on just to chat with people along the way. And there's lots of changes. I've been doing the Medicare stuff since 2010 and I've been watching the marketplace and seeing a lot of changes along the way. And so it's always fun to reach out and watch the news. We're going to watch the news. But before we do all of that, we got to bring on Leith onto the stage if I can get it. Good morning, Leith.
Good morning, Mark.
Well, you're having fun. I know last week you were watching the Medicare news for us and such like that.
It's crazy out there. It's crazy.
Well,
it changes so fast. It's like you read one thing and you find, and then something else comes up, and it's like, oh my gosh, now what? So.
Well, and you're talking to your friends, right? And so You're talking to your friends, and they're wondering what's going on. They're turning to you, find out what's going on, right?
Right.
Oh my goodness. So, yeah, and so it's fun to go through and look at the news together. We're going to do that right now. We found an interesting piece of news right now that we wanted to share with you. So let's bring that up onto the stage here. This is from Market Watch. Market Watch, let's see, when is this dated here? I think it's dated today, updated October 17th. So a couple days ago from Market Watch here says that new Medicare Advantage navigation tool contains inaccuracies, faces hiccups as open enrollment begins. The directory contains inaccuracies that confuse. The federal government's new directory that allows people to look up which doctors and hospitals accept different Medicare plan Advantage plans contains errors, creating confusion. I mean, Leith, as retirees, do we want to have confusion?
No. A couple of the people I talked to last week, and then they called me earlier or later this week and said, "What's going on? You told me thus and so." And it's like, "Oh, it's changed already."
It has changed already. Yeah. So, So that is the newly created portal features errors. Let's see if we can highlight this here. The newly created portal features errors and conflicting information that could lead seniors to sign up for the wrong plan and to potentially face higher costs down the road if their doctor isn't covered, experts say. The problems with the Medicare Plan Finder portal was first reported by the Washington Post. The creation of this new directory was announced in June, and the scope was narrowed in August to focus just on Medicare Advantage rather than the entire range of Medicare caregivers. Previously, beneficiaries had to wade through listings on dozens of websites. And the thing is, too, Leith, is we like online portal stuff. We like that. But the problem is, if it's wrong information, this creates a problem, right? It's, right. So there's a problem. It's a big problem. The good news is it could be corrected fairly quickly. Who knows what it is? So It seems that this tool was not adequately tested, which is perhaps not surprising in light of the rushed implementation timeline. In general, I think federal agencies are often too risk-averse when deploying these types of tools. An imperfect tool is often better than no tool at all, but this type of problems, the Centers for Medicare and Medicaid Services, is now encountering illustrates that there are very real trade-offs to moving fast, says Matthew Fiedler, senior fellow. So isn't that special, huh? Isn't that special?
I mean, it's not funny, but I can't help but laugh. It's like, here we are in the middle of enrollment season and people aren't getting the correct information.
Yeah.
Or they're getting the information, but when they sign up, they don't know if it's going to be correct.
Yeah. So that's why we always talk about this is where having someone you trust and and work with directly is so important. Let's move on over to a piece over here on let's try this here, and we're gonna we are doing this live so that we can get the most relevant. So this is who is this? This is Yahoo Finance. Yahoo Finance. What to watch for in your 2026 Medicare Advantage plan. Changes to expect. This was published October 18 by Carrie Hannon, a senior columnist over at Yahoo Finance. Millions of seniors with Medicare Advantage plans can expect slimmed down benefits, loftier premiums, and reduced selection of options in 2026 plans. And what that means is this is not the year to skip reviewing your coverage during open enrollment, which kicked off last week. In September, you received annual notice of change. Again, folks, we're only talking to those right now that have a Medicare Advantage plan, because we believe in Medicare supplements, but we want to bring the truth out as to what's going on in Medicare Advantage to make sure you know. And so this open enrollment does run through December 7th for the Med Advantage plans and the Medicare Part D cards. Okay. Right now, you can switch between original Medicare and Medicare Advantage and make a change in Medicare Advantage plans and switch your Part D. Now, here's the key here, and this is something that we are proponents of, is to look at possibly going back to original Medicare if you're on a Medicare Advantage plan, and then looking to see if you can get into a Medigap plan, which is going to eliminate a lot of these network issues that we're talking about, et cetera. There's a little bit of work that did be done, but people find much more freedom in the Medicare supplement type of thing. So, anything you want to add here, Leith? I'm just buzzing through here. I think part of the thing that people don't understand is with these Medicare Advantage plans, there's a relationship between the government and the insurance companies, and that's always changing here, right? That's
right.
That's changed. So some insurers are de-emphasizing or even pulling out of certain geographic markets. So if you are in a county, that is your Medicare Advantage plan is leaving, there are some good options. We just got to find what those options are. And there's some solid options. I help people. This happened in our area back in 2010, 2011 when I was helping people. Is that does happen. There's some good options there.
Well, it's happening now. I mean, I heard about a large insurer that's stopping one of their Med Advantage plans. I don't know if it's all of them, but people are getting letters saying, you have to change by January 1st.
Yeah.
That's when
right.
the plan is going to end.
That's right.
And so there's, people are scrambling now, not knowing what to do. And it's a Med Advantage plan, so they can either go find another Med Advantage plan or go to a Medigap.
Yep.
Which they won't run into this. They're not going to have the restrictions. So.
That's right. So, yeah. So that's over on Yahoo Finance. It's the news is just absolutely fraught with these Medicare Advantage plans that are making big changes along the way. And so we do, and as we said in past episodes as well, we are a big advocate of going to Medicare.gov, but we as agents are able to help people navigate through Medicare.gov and really look for great opportunities there too. Now, moving on, we wanted to do a little bit of education here along the way here. A little bit. We like educating, don't we, Leith?
Yep.
We do.
Most fun.
It is the most fun. So let me go ahead and pull up a screen here. Before and then of course, if someone is joining us, if someone is joining us for the first time, we are also advocating as well. If I can pull it, let's see where I'm going with this here. Let's see if I can do this, and then I'm going to do ahead and add this to stage. We are also a big advocates of the Medicare and U-Book. Okay, so if you have this in the mail, look to make sure you got it. And this is a very good resource. And if you watch some of our other streams, this is something that we've had. Hey, look at that. Look who we have on deck. We have Claudia. Claudia, can you hear us?
Yes, I can. Good morning.
Bring that mic close. Bring that mic close and talk to us.
Yes, yes, I can. Sure. Can you hear me now, Bear?
Yeah. So, oopsie. So let's see here. One moment here. I'm sitting here. There we go. So what's nice about having Claudia and Leith here, just for everybody's thing, is Leith has been licensed for 20 years and is a Medicare beneficiary. You wouldn't know it, you wouldn't see it, but she is.
Thank you, Mark.
And so so she has that perspective of both the uses as well. Claudia, on the other hand, is not quite Medicare beneficiary yet. That's still next year, and so up and coming. And so she's going to learn what's important for her own personal use of Medicare. So, and you have you been learning, Claudia, along the way?
Oh yes, I've learned a lot actually in the last couple of years.
Yeah.
So, but I understand there's new changes for this year, so I'm kind of eager to know what those changes are.
That's right. So, what I was going to do is we were actually going to go through. I'm going to share a screen here. Do a window here. Show the screen. We are going to. There we go. All right. So I hope everybody can see this. I think this is very, very educational to really understand. After doing this for so long, I want to walk people through what I call the house of healthcare. All right. So we have Medicare A. This is your Part A that you have on your Medicare card. That's the hospitalization. All right. And that involves when you check into the hospital. That's going to be, and I say admitted. I use the word admitted because there are games that are being played out there where you're not admitted and you're still an outpatient, but you're in the emergency room. And so that is Part A. And you have to understand this. The reason why we're going to walk these pieces up is you have to understand Part A. And there's a few things to it. We're not going to get into the details, but you're not paying premiums for this because you paid for the premiums all your life while you were working. Then we have Part B. Part B is something that is your outpatient, your doctors, your testings, your treatments, your therapies. That is what that is. You do pay a premium for that. That's $206 a month. $206. It keeps going up, and that's typically deducted from your Social Security. Then on Original Medicare, you do have the idea to opt in to a Part D plan. And the Part D plan is definitely something you got to get reviewed right now, October 15th through December 7th. I've had people say, well, Mark, I don't take drugs. Well, guess what? Look at the premiums out there. In the times past, there's been zero premiums. There's probably cheap stuff. At least get it, because if you don't get a Part D card along the way and you decide to pick one up later, there's going to be a escalating fee over the course of time, and people don't like to know about this. When they're 5-10 years down the road without a Part D plan, they decide to get one. So make sure you understand that. That's the fundamentals of the Medicare Part A, Part B, and Part D. We are advocates here of Medigap plans, or known as Medicare supplement plans. And basically, they're going to plug the holes, the stuff that what Part B leaves, and plug the holes that Part A leaves. And the premise of this is these are called guaranteed renewable. Guaranteed renewable means they just keep on going on for you as long as you pay the premiums. There's no network. You don't have to choose which doctor you go to. You go to who you desire to go to. And so these Medigap plans are what we have seen retirees find the happiest for, because they can go where they go. Now, some argument may be, well, Mark or Leith, I can't afford it, or I don't know. I want my zero premium plan over Medicare Advantage. Well, you get what you pay for, right, Leith?
Right. And Med Advantage plans are different because you've got, these out-of-pocket maximums, and there's certain things, we're not really going to go into the Med Advantage workings, but there's a lot to look at. I mean, don't
Yeah.
just look at the zero premium. It
Right.
sounds great. Oh, you don't have a premium. There's other costs with those Med Advantage plans. So
That's right. Like you said, it's that exposure. So the Medigap plan, we've got our little secrets that we share. We share that privately as to how we make those affordable along the way. Now we're not talking about today, but dental, vision, hearing. Dental, vision, hearing. I've dealt with a lot of retirees. They just give up on their dental work. It's too costly, whatever. And I say, in your income plan, build in some kind of plan. It could be an insurance plan. There's some great insurance plans in certain areas of the country. Is to look at a dental plan that gets you going in and taking care of the teeth along the way, vision and hearing. So that's something that I believe is very, very important. We talk about that later. Lastly, cancer hospital indemnity plans. I can't tell you how big a deal this is because there are holes that are going on, and you can get these things affordably at a younger age. And many people find there are lots of expenses associated with a cancer situation or associated with a hospital stay or even after the stay, and that's that. Lastly, the whole thing is built on a foundation. The whole thing is built on a foundation of custodial care. If your house of healthcare does not have custodial care, what that means is what needs if you have a care at home, care in a facility. If you don't have that address, guess what you're going to tap? Your savings account is going to pay for the care at home or care in a facility. And that's where the house will crumble. That's where the house will crumble. Notice the fact, too, there are affordable things in other states. Now, Leith and I are in Washington State, but we operate in many states. There are what we call short-term care plans that are actually very affordable in other states. They're not available in Washington State, not available in California and New York and a few others. But these things are very affordable to put into our place generally as well. Is that it, Claudia? Is that you've seen this before? Is this making sense?
Yes, actually, it makes a lot of sense, especially to just have a visual picture of what all this Medicare plan really entails. And if you're not familiar with it, this really helps to get familiarized and learn more about it.
And draw it on your own pad of paper, right?
Hopefully.
Draw it on your own pad of paper, yeah.
Yes.
So, and just to do a quick recap, that Part A, that's on your Medicare card. Part B is on your Medicare card. Those are, and you can see up on the screen, Part A, Leith has made this slide that, pages 25 through 29, the Medicare New Book. Jump over to page 30 to 55 in the Medicare for Part B. And those are where you see it too. Again, Medigap plans, man. I tell you what, we are big advocates. We're going to see this moving forward. This is going to be a thing that we take the headaches away from retirees because Medigap plans are allowing you to go anywhere you want to go. Yes, if you desire to get a plan that has some small expenses that you're exposed for, we show you how to plug those holes, but giving you the freedom to be able to still be able to go anywhere you want to go and not have so much of the managed care along the way. Now, our retirees that are out in rural, I'm a big fan of the rural retirees. I want to talk to the rural retirees. These are absolutely critical, these Medigap plans. Any thoughts on that, Leith?
No, I guess
Hey,
you just can't say enough. I can't say enough for the Medigap plans.
Right. You had the mindset here. What was it? A year ago, 2 years ago? Come on, Leith, tell the story, right?
Yeah, well, so a couple years ago, I was changing plans, and I'd been on a Med Advantage plan. It's like, oh, Mark, I don't know if I can go to that Medigap plan. Oh, I'm gonna have to pay so much, and I recently had a experience being ambulanced to the hospital. It was nothing big, but I was quite surprised how it paid and how little out of pocket I had. It was. I mean, I know how it works, and what happens when you do get sick. I've been through that, and so it's it's very comprehensive to have the Medigap supplement plan
And
with the Medicare.
and when you're in the ambulance, Leith, you don't have to think about.
I didn't have to think about, oh, are they taking me to the right hospital? And, of which I was doing. And they were looking at me there, why don't you just shut up, lady? We're not going to take care of you.
Listen to that. Listen to that. You're having a medical thing and you're thinking, am I going to the right networked hospital?
But I thought through my mind, I thought, oh, I don't have to worry where I go. And they said, where do you want to go? I said, oh, I don't care, wherever you want to take me. So,
Yeah, that's good. That's a Medicare supplement right there for you.
but yeah, I can, and receiving the, what I can say is, you're going to get the explanation of benefits every time you have a service. You're going to get that from Medicare.
Right.
The length of time it takes him to pay it is long. So, I kept wondering, where's my bill at? Where's my bill at?
Right.
6 months later, I get a bill.
Right.
And then it automatically goes to your Medicare supplement plan. So Medicare pays first, then the provider automatically sends it to your Medicare supplement plan. They pay,
Yeah.
and they send you an explanation of benefits. So it's really, you have to do a little more work looking at these things than you do with the Med Advantage plan. But
Yeah.
I mean, I'm totally sold on them. I think it's a great option.
Yeah, and I just want to throw this up. So this is what we're saying. We're saying Medicare plus a Medicare supplement, plus a Part D. You still have to attach a
Right.
Part D to it as well. But anyway, yeah. And for full disclosure, Leith, right? I go back to this. It took us about 4 phone calls to figure out how to make
That part.
how to get your mind wrapped around the right Medicare supplement that's affordable, but gives you all that freedom.
Well, and I think what you find is people, I mean, I was blessed to have good health care through my employer for
Yeah.
my whole working career. I never had to worry about it.
Yeah.
And so, it was just there, and I just, didn't think about it.
Right.
And that's with a lot of people. You've had good health insurance through an employer, and so now you have to think about it.
Yep. And that's a good point. People have to think about it. They're not thinking about it. They just want to, so this is the time of year to think about it and such like that. So, let's just wrap it up, running back over to, where were we here? We were sitting over here. I'm using a new computer system for a new streaming system today. And I lost Claudia, but we're going to add her back to the stage. And let's throw this up here. What else do we got? Oh, Part Ds. Let's do one more here. Well, we got the House of Healthcare, dental plans, vision, hearing, custodial care. We already talked about all that. So these are additional things to start building the house. If you want to build the House of Healthcare, you do it piece by piece by piece, and that's how that works. So, well, very good. You say, well, hey, how in the world do we get a hold of you? All right. Well, let's throw that back up here. So, well, first off, we're streaming live every Monday right now. We're streaming live. And so, we like to stream live because we keep connecting with people this way. We want to make sure we can help as many people we can, specifically coming through the Medicare season right now. And then we also set up for everybody too a nice little 10 a.m. Zoom hour. If you want to join us over on the Zoom hour, it's going to be happening 35 minutes from now. We'll turn on Zoom. We'll be over in there, and you can go to TT65 Office Hour. That stands for Talking Turning 65, TT65officehour.com. Thirdly, Leith does have her calendar up here, learnwithleith.com, and that is where you can go on there and find specifically a little 30-minute slot to talk to Leith. My calendar, markscalendar.com, that is there as well. And so with that, is there anything more that we need any further thoughts, Claudia, before we jump off?
Well, what I was just sitting here and just thinking about that last slide you just showed. as you're trying to negotiate navigate
Mm-hmm.
this turning 65
Yeah.
process,
Yeah.
it really helps to have the steps in place of what is expected of you,
Mm-hmm.
to make sure that you don't end up with penalties down the road, like you were talking about the Part
Right.
D.
Right.
My mom, when we signed her up, we didn't know about Part D. We didn't know any of this. And so guess what? She ended up paying penalties every
Mm-hmm.
year, because she didn't sign up in time for it. We signed up,
Oh,
later.
right.
And
Right.
so that was because we didn't know. And really nobody explained it to us, and we just didn't know. So that's one thing, and that's why your explanation here is so good, and your presentation is good, because it outlines and it gives you the information you need so that you don't make any costly mistakes like that.
Right. No, you're right. It's working with someone, getting someone ahead. And I've also said this too, Claudia, is if there's adult children that need to be working with their parents as well, right?
Yes.
Because this stuff, as I've said in the past, this stuff is going to get more and more complex as time goes on.
Yes.
And it's going to go electronic. This is all going electronic. All the insurance companies are going electronic, and retirees don't necessarily have that aptitude, that desire to be electronic as well. So this is why I say, if you're younger, if you're a kid, adult kid, 40s, 50s, is whoopsie, my camera went away. I guess I'm no longer here. You hear? Can you hear me?
We can hear you.
Yeah, we
You
can hear
me. Well, somehow my camera went away. Oh my goodness, this is so funny.
There you go.
There we go. Well, anyway, we'll go ahead and sign off, and we'll see everybody over in the office hour coming up right now. The office hour is going to be up around the corner here in 35 minutes. We'll see everybody next Monday morning, or we'll see you in the Zoom, or hit the counter links. We'll see ya.
Okay.
Well, friends, we've reached the end of our 30-minute journey on Talking Turning 65. I hope today's conversation shed light on the challenges and opportunities you face as a rural retiree in the West. See how our Social Security income can be maximized. We know the struggles to create lifetime income. Seek to plan for tax-free income. Build Medicare planning that is affordable. And learn about long-term care planning that doesn't drain the savings accounts when a crisis happens. Have our wills and trusts current, so our family has our desires and not have the state make decisions. If you found value in today's show, please hit like, subscribe to our channel, and share this program with a neighbor or friend. Together, we'll keep the conversation honest and helpful for years to come. Thanks for tuning in, and we'll see you next time on Talking Turning 65.